The director of the Noguchi Center for Medical Research says Ghanaians should be worried following the death of a second person to coronavirus. According to him, the developments present a clear challenge for the country in stopping further spread of the virus, which is wreaking havoc globally. In an exclusive interview with my colleague Elton Brobe, Professor Abraham Kobna Annan proposed testing and lockdown of communities, adding the days to follow present clear danger for the country.
Community transmission, that is transmission within. And with that one means also that we have to escalate everything, even including testing. And the government is actually on top of it because the government has given various measures, providing guidance as to how, as a nation, we should proceed. Apart from giving certain measures to limit, gatherings and crowds and things, it's also issued measures to ensure that even those who are coming from outside are quarantined and tested. And as we speak, through that mechanism, we have had hundreds of samples from travelers who are coming into Ghana, and we have upscaled our testing. And this is ongoing, and the results, we are using the channels that have been established by the nation. Already the Ministry of Health, interministerial, partnerships have been created, and we have the Ministry of Health working with the others, including the Ministry of Information, and with the Ministry of Information being in the forefront to communicate the results to the public and to the, to Ghanaians in general. So this system is working very well for us, and we have capacity to test. Initially, we were testing far below our capacity because we were testing in the tens and not even in the hundreds. Now we are in the hundreds. In actual fact, as an institute, we have the capacity to test about 1,000 samples per day. That can be per day.
But let me ask you, so far, Ghana, according to the Ghana Health Service, we have 27 confirmed cases. Yesterday, we were told of a second death, which brings the number to 2.
Yes.
Now, the director, the presidential advisor on health says that they've traced over 1,000 people whom they are monitoring as far as the COVID-19 is concerned. As a Ghanaian, should I be worried and should I, entertain fear as we record more deaths?
Yeah, this is a very nice question. Yes, you should be worried. But remember one thing, health is not just a physical well-being. It is physical and psychological well-being. So much as we should be worried in the sense that we should identify that there is a challenge. And then we should then channel our energies and resources into using the methods, the approaches, the tools we have to be able to mitigate the challenge, to stop the spread of COVID. So really, we should not be afraid. As for fear, is an enemy. If anybody is afraid, it weakens all of us, especially if you were to get infected, diagnosed to be positive with COVID-19. The last thing you should do is to be afraid. You shouldn't be afraid because it can be managed.
Some say that this week and next week is actually crucial for Ghana. Yes. Why is it so?
Yeah, this week and next week are extremely crucial because we need to take a very important decision. The decision is concerning whether to lock down or not to lock down. But you see, to lock down or not to lock down, it depends on so many factors.